Hi. Before we start, I have a question. How much does it cost to develop a drug?
A drug,
Yes.
like each million,
$8 million?
yeah, dollar, yeah,
Okay.
or more.
Drug to develop a drug.
It takes $8 million.
And for the time duration,
It depends.
10 years, 20 years,
how much?
10, 20 years.
Okay. So it costs between and over than $2.2 billion, and it takes between 10 to 15 years. But the problem is that 90% of the drugs that go to clinical trials fails.
Yeah.
So that's why today we're gonna see some alternative methods in R&D in order to make the process faster and also less costly. So let's start with the revolution of in silico. When we talk about in silico, we mean computer. So here, in this method, it allows us to move from the candidate to a drug in a very fast way. And the goal is to predict efficacy, activity, and toxicity even before going into the laboratory. So the first step is the identification of hits. So here we are talking about the role of virtual screening and the molecular docking. So we virtually test millions of drugs of molecules in order against a disease, which is it can be a protein or enzyme. The computer calculates the binding energy and the optimal spatial geometry. It is like trying thousands of keys in a lock within just minutes. So for the first, it was for when we talk about molecular docking, it is just like we're taking a screenshot for just one moment. But for in order to validate whether the interaction is stable over time, we move to molecular dynamic, what we call the MD. So it simulates the movement of atoms over nanoseconds, and it gives us a movie of the interaction. So this answer does the molecule stay in the pocket while the protein is moving or not? It gives just like a movie like this. So the other thing is in the best molecule that binds to the target, it can fail if it doesn't reach where it needs to be, or also if it is toxic. That's why we use the ADME tools in order to predict how the molecule will be absorbed, distributed, metabolized, and also if it is toxic. So the advantage is we can eliminate poor candidates at the computational stage without wasting months and money on in vitro or animal testing. So the most famous example of using in silico.
Sorry.
Yes.
We can know the toxicity of the molecules before.
Yes. Using some servers. Yes.
Okay.
Online. So the most promising method in the in silico field is the drug repositioning. So it is really a perfect example because we can use screening tools to find the new targets for already existing drugs. Those drugs are already their safety profile is already known. The huge advantage is that we can skip much of the preclinical toxicity and safety testing. It is like the fastest way to bring compound into clinical trials, And the example here is a drug that's normally is prescribed for the high blood pressure, but in the COVID pandemic, they used it as a drug in order to inhibit the
Because
penetration
of
of the COVID-19.
the virus.
So, also beyond the digital methods, biology itself is modernizing also. These changes are guided by the ethical principles of the 3 R's. We have the replacement of animals with alternative methods. Also, we have reduction the number of animals as much as we can, and refinement of the protocols in order to improve their welfare. So this both an ethical obligation and often a regulatory requirement in modern research. So how do we replace animals? With more relevant human models? We have the organoids. There are 3D mini organs grown from stem cells that mimic a real function and architecture of the organ, like mini liver, mini brain, etc. And also we have the organ on one sheep. But it's go further by using microfluid to simulate blood flow and mechanical interaction as well. So we have another example, which is using mathematics in pharmacology by modeling the pharmacokinetics and pharmacodynamics. This method is very useful when we want to know the dose to give for example, for kids or for pregnant women, because most of the clinical trials are not done on the pregnant women or kids. So we can use maths in order to calculate the right dose for this people. So, but to conclude, I just want to say that pharmacology is no longer limited to the wet lab. We can do it using our laptop as well. Do you have any question?
Yes. Thank you.